have a motion and second on the floor to approve the minutes as written. All in favor?
Aye.
Aye.
Opposed? Okay, the minutes are approved as written. Today we have 4 action items. And so we're just going to dive right in as far as Aging and Developmental Disability Services Division. I understand we have staff here on the meeting. I'd ask you just to identify yourself and proceed with this item. Do we have anyone here from ADSD, Office of Community Living? What I'll do then is just hold on this agenda item and we'll circle back to it.
Okay.
I want to proceed with agenda item 5, the Division of Public and Behavioral Health. Lori Taylor.
Hi, my name is Amber Heiss. I'm actually filling in for Lori Taylor today.
Great, thank you.
She had to be out unexpectedly. And so our team is wanting to present. We did a notice of funding opportunity for some state funds that we have for our tobacco program and also for our Office of Food Security, so our hunger funds. And our 2 programs have then come together with a presentation for the grants management or this body to approve those funds going forward. So actually, I don't know who wants to go first, either Talaman Offrons or Dylan Winkleman. I'll let you guys decide who wants to go first on presenting your findings.
I would invite Dylan because he has a talk about.
Thank you, Talaman.
Yeah.
Hi, so Dylan Winkleman for the record. I'm going to share my presentation if that's okay, or share my screen.
Please proceed.
Can everyone see that okay?
On my screen is good.
All right, so hi everyone, my name is Dr. Dylan Winkleman. I am the Food Security and Wellness Evaluator for our Food Security and Wellness program. I provided administrative support for this committee. I was not part of the committee, but today we're going to be looking at the Fund for Healthy Nevada Hunger Fund recommendations. Just to give a little bit of background about Department of Public and Behavioral Health, so DBPH. So our mission is to protect and improve the physical and behavioral health and safety of all people in Nevada, equitably and regardless of circumstances, so they can live their safest, longest, healthiest, and happiest life. Our vision is to have a Nevada where preventable health and safety issues no longer impact the opportunity for all people to live life in the best possible health. And then our purpose is to make everyone's life healthier, happier, longer, and safer. All right, so now we're going to get into the background about FHN Hunger Funds, just kind of give a brief overview of where we're at right now, what potential partners that we have currently, and kind of give a background about the NOFO. So the FHN Hunger Funds, for those of you who don't know, is derived from our tobacco settlement funds. Its aim is to help reduce hunger, so food insecurity in the state of Nevada. To be able to receive these funds, we release what they call the NOFO, or the Notice of Funding Opportunity. This is supported by the 2023 Food Security Strategic Plan. Again, its goal is to try to help feed Nevadans throughout the state. And the requirements when we're thinking about the NOFO is having at least 2 or more collaborative partners when applying for this, addressing short-term and long-term goals when we're thinking of food security in the state of Nevada, as well as targeting Nevadans of all ages and then any population that's disproportionately affected by food insecurity, for instance. So currently I'm going to focus on state fiscal year 24, just to give you a little bit of a background about our current partners, because we're still in state fiscal year 25 currently. So right now we have 11 partners. They almost $2 million was distributed to those partners, and they almost distributed that, or spent the complete amount of that. So it was only about $6,000 left over from those partners. Between those 11 partners, they serve all 17 counties in Nevada, and they base their goals off of that Nevada Food Strategic Plan. So we have 2 major themes, which is going to be feed. So feeding Nevada's population at higher risk for food insecurity, And then the other theme is build. So build Nevada's food security ecosystem by increasing capacity and education. The service provided by those different partners include walk-in, drive-through, and mobile food pantries. We have a fruit and vegetable prescription program, farmers markets, student and senior meals. So when we're thinking about the timeline, we'll briefly go over that and kind of how this process goes. The NOFO was released in January of 2025 of this year. We had letters of intent due January 31st. And then any questions related to the NOFO or their applications was on February 6th. Applications are due February 20th of 2025. And then the reviewing process started the week after that. So February 24th is when the applications were starting to be reviewed by the committee. It was originally supposed to end on March 14th, but the committee decided they need one extra week to go over funds and determine who they wanted to receive funds. So we extended that to March 20th. The reporting of funds is what I'm going to be presenting on today. So that'll be during this month. And then we'll have the Grants Management Advisory Committee hopefully make their recommendations this month based on this presentation. We'll work on their work plans for those particular partners May 5th, and hopefully have everything finalized and funds distributed by July 1st. So just to give you a brief overview of some of the committee members that were part of this committee in deciding this. We have Laura Evans, so she was part of the Nevada WIC program, so Women, Infants, and Children. We have Taylor Mosley, so he's part of CDPHP, so he's one of our evaluators, as well as Allison Gonzalez. She's another evaluator for CDPHP, it's a separate program. We have Michelle McNeely, she's with the Grants Management Unit. Lindsay Talbot, she was with the Nevada Department of Agriculture. And then lastly, we have Saida Monroe, and she was an AmeriCorps intern. So briefly going to the evaluation process, how these were graded, how they were evaluated. So they did use a template/rubric that was provided in the NOFO. So it's attached here, and you'll see it in Appendix C and D is what the grading rubric was used. Each applicant was reviewed twice by 2 different committee members. And then any applicants that were removed or disqualified because they didn't reach one of the grading rubrics in Appendix C was actually double checked by staff too to make sure they were actually disqualified. And then we attended 4 different meetings throughout this process, which includes to look over point discrepancies among committee members, rankings, and any questions committee members might have. So diving into the applications. So we had more applications this year than we've had in the past. We had about 19 different applications. So we had the Asian Community Development Council, Boys and Girls Club of Truckee Meadows, Capella Family Resource Center, Catholic Charities of Northern Nevada, Communities in Schools, Communities Food Pantry, Desert Springs Community Resource Center, Dignity Health St. Rose Dominican, Friends in Service Helping, Food Bank of Northern Nevada, Nevada Rural Counties Retired and Senior Volunteer Program, Northern Nevada Dream Center, Nutrition for Life Collaboration Helping Hands, NyE Communities Coalition, 3 Square, the University of Nevada, Reno, their Veggies for Seniors and Kids program, Washoe County Human Service Agency, and the Washoe County School District. We did have some applicants that withdrew from this process. So that was Green Side Up Vertical Farms. They said they withdrew due to capacity problems. Keystone removed. They were one of our current partners. They didn't give us any reason why they withdrew their application. Life Changes Incorporated also mentioned capacity is why they removed. Salvation Army was capacity. Green Our Planet removed because they had no formal agreements with any other partners. And then we had Nevada Health Resources, which didn't provide us a reason for why they withdrew their application. So looking at the applications that were removed because they specifically missed one of the appendix was the Asian Community Development Council, Capella Family Resource Centers, Community Food Pantry, Desert Springs Community Resource Center, Friends in Helping, and then the Nevada Rural Counties Retired Senior and Volunteer Program. So to go a little more detail on the reasons for disqualification is we had Appendix C, so Part 1 and Part 2. And so I'm going to dive a little bit into some of the parts of that appendix and what those particular partners were missing and why they didn't go further in the review process. So specifically looking at Part 1, one of the sections was to make sure that all the sections of the application had been completed, including checkboxes. And so the Asian Community Development did not have that. The Community Family Pantry did not. Desert Springs Resource Center, Nevada Rural communities, and then the Capital Family Resource Center. The third-party payer section and the federal tax ID were both missing from the community food pantry. And then Desert Springs Community Resource was both missing their authorized official signature and their current funding section. For Appendix C, so I should mention too, for Part 1, if they were missing one of those, they were removed. And if Part C, if you're missing 2, you're removed from the reviewing process. So for the budget attached, the Asian Community Development was missing their budget. We had the Community Food Pantry was missing, Friends in Service Helping, as well as the Capital Family Resource Center. Looking at budget percentages, most likely this was dealing with the 50% food procurement. So Asian Community Development Centers was missing something related to their budget percentages, the Community Food Pantry, as well as the Capital Family Resource Center. And then looking back down here to the assurance and provisions, the Asian Community Development Center, Community Food Pantry, and Fish were both all missing their assurances and provisions. And then Fish was missing a couple of their resumes that they needed to have attached to their application. Of those, the qualified applicants, we had Boys and Girls Club of Truckee Meadows, Catholic Charities of Northern Nevada, Communities in Schools, Dignity Health St. Rose, Food Bank of Northern Nevada Dream Center, NyE Communities Coalition, 3 Square, University of Nevada, Reno, Washoe County School District, and then Washoe County Health and Human Services, as well as Nutrition for Life collaboration, Helping Hands. So these are all the applicants that moved on to the reviewing phase and scoring phase. So just briefly looking at Appendix C, some of the scoring breakdown. So this includes your abstract, which was worth 3 points. You had the actual application was 10. Organizational description, 5. The project design and implementation of that specific program, 15. Community organizations and partnerships, health equity barriers, capabilities and competencies, data collection and evaluation, their actual scope of work, which we'll be using for their program, their budget narrative, their resume, all leading to 100 points. So they could have a total of 100 points in the scoring process. So of those applications, we have 12 top ranking applicants. So that was Catholic Charities, got a score out of 100 out of 100. Followed by Food Bank, 98, NyE Communities Coalition, 97, CIS, Communities in Schools, was 96.5, 3 Scare was 96, Northern Nevada Dream Center was 95.5, Washoe County School District, 95, UNR, so University of Reno, Nevada, was 94.25, Helping Hands was 94.25, Dignity Health was 94, Washoe County Human Services Agency was 93.25, and then Boys and Girls Club of Truckee Meadows was 91. So these are the recommended applicants for funding based on the committee, based off those 12. So we have Catholic Charities, Food Bank, NyE Communities Coalition, Communities in Schools, 3 Square, Northern Nevada Dream Center, University of Nevada, Reno, Dignity Health, and then Washoe County Human Services Agency. So a total of 9 partners out of those 12. The main reason for the recommendation is all the applicants have a score above a 90. The combination of the different applicants all covered the entire state, so we're able to provide resources throughout Nevada. And each program provided in their own kind of form different types of services, so they're not providing all the same services. The applicants that weren't recommended were Washoe County School District. Main reason behind that was because they didn't reach their 50% food procurement. The committee felt that was really important to try to reach that. Nutrition for Life collaboration, they had a very high budget, and the committee thought it was really difficult to potentially parse that down. It was going to be over probably around 2/3 of the whole entire budget. So they thought that was really high. And then they were missing their assurances and provision page. And then the Boys and Girls Club of Truckee Meadows, they were already receiving funds for the same program through the Department of Agriculture. So there was some confusion about what if the program was trying to expand in that aspect. They only had one budget set attached, and then just with funding restraints, they did have the lowest score for all partners. So currently we're going to look at kind of the funding breakdown now. So the original funding thought when the NOFO was released and before or when the applications were submitted was thought to be a little over $2 million for state fiscal year 26 and 27. However, the allocated funds came out to be only about 1.8 or a little bit over that for both 26 and 27. So we had to kind of adjust for that. The committee had to adjust for that when thinking about budgetary restraints, because that dropped it by about 9% than what the original funding was thought to be. So this will give you an example of kind of what the committee's recommendations were for each program for funds. So the current request based on their application, if you add up all the total of all the partners, was about 2.6. So we know that's significantly higher than what we have, about that 1.8. So the committee thought about looking at past funding. Since our programs that they were recommending are receiving funding right now. So we looked at 24 to kind of match with the 25 or with the 26, and that was still over the budget of currently what we have. So it's still about 1.9 million. So then the committee decided to take a 5% reduction across the board, and that brought it down to a little below the allocated amount. So about 1.8 million, 1.82. That left over about $20,000 that we had. So the committee decided to add that to each partner equally. So it was about $2,000, a little over $2,000 that was added back to each partner. There was 2 cents left over. That was just, the committee decided that they would just add that to Catholic Charities since they got the highest score. So that is the budget recommended for 26. We'll move on to 27. It's very similar. There is a slight increase for 27. So this one, again, similar, that 2.6 million for their current request. Again, a lot of the partners were basing it off of we were going to have that more funding, but because that did go down, we had to, the committee had to adjust for that. So again, looking at past funding, that was about 1.9 million. So it's still over the allocated funds we have currently. So again, doing that 5% reduction left about 26,000. So then that was equally distributed about 2,800 to each partner. And then similarly as before, there was 10 cents this time left over. And then that extra was given to Catholic Charities because they had the highest score. Just thinking about funding determination, the committee really wanted to have an equal distribution and cuts across the board. So they didn't want to try to exclude or single out any partner by removing more percentage from one partner than the other and how to try to determine that. That's why they did the across the board 5% decrease. And then I'm going to hand this over to our section manager, Amber Heiss. She's going to go over the recommendations for the Office of Food Security that Lori Taylor was going to go over.
Okay, thank you. Very thorough presentation.
Thank you, Dylan. So some of the things that the Office of Food Security needed to take into consideration was the look at our partners over the 9 partners, and does that meet the needs of the Office of Food Security over the state of Nevada? And one of the things that the office has talked about is potentially cutting that down to another, cutting that down by from 9 to 7, so that we could potentially put 2 of those partners under, link them with 2 of the larger organizations, so that we can further expand that funding over, because there was a decrease in our funds from what we originally thought. So we wanted to link applicants who disqualified to the food banks and the pantries to identify resources such as refrigerators and program food support. So even though some of those other organizations have disqualified, we want to link them with those larger organizations so that we can still continue to provide necessary resources for our communities, and then also participate in consolidation opportunities to total to bring our total from 9 to 7, so that again we can streamline and improve the efficiency of the programs and overall outcomes. Because ultimately our goal is to use the best bang for our buck when we're because we did get a decrease in those funds. I believe there's another slide, Dylan. You want to move on?
Yeah, there'll be 2 slides just giving an example of the budget.
Perfect. And so these are the funding opportunities. If we are able to take them down, if we were able to go down from 9 to 7. And so you can see over on the left-hand side, those are partners that we are currently looking at partnering with, and then what the Office of Food Security recommends. So the Office of Food Security does recommend that, I believe, UNR and one other program go under, they connect with 3 Square and Catholic Charities, so that they have a better opportunity to collaborate. And then can we go on to the next one?
Yep. Yeah, and the next one will be just a very similar, it's just another breakdown by partners and just that slightly different in funding. So yeah, it'd be Catholic Charities partnering with UNR and 3 Square partnering with NyE, with the Office of Food Security recommendation.
And then if we want to move on to question, I believe the next one is questions, correct? Yeah. If you have any questions for us.
If there's any questions, we'll try to
So
answer
I
the
didn't have
best
much
we
to
can.
add.
Very good. First of all, very thorough, both of you. The slide's very informative, so we appreciate this level of detail. So having said that, members of the committee, any questions for our 2 presenters on this agenda item?
Hi, this is Elisa Berlin. So my question is for the recommended partnerships, when you say that there would be one primary organization who receives the funding, would the secondary be a sub-awardee of the primary, or would they be managed, or would their funding be managed separately?
So I believe how we discussed this was they wouldn't necessarily be a subawardee, that they would be a partner. So like, for instance, UNR with, did we say Catholic Charities? So if they partner together on those 2, then that would be like I don't want to say a pass-through partner, but they would work in collaboration, and it would need to be in their scope of work, in the Catholic Charities scope of work, that they would work with this with UNR. So it would have to be in their scope of work that they would have a collaboration, so that it continues to, so that money still funds to that, or flows to them, but it doesn't necessarily flow through the original FHN funds, if that makes sense.
Yeah, and there would be just to mention, no decrease in funding to UNR. It would just be the same amount would be given to Catholic Charities, and they would just partner together, just to state too.
Okay, any other questions?
It looks like there's another question from Stacy.
Hi, yeah, I'm just following up on that question. So I'm not sure if I'm following completely. So we would be encouraged to partner with 3 Square in that case, as we're NyE Communities Coalition, but we have no funding. So I'm not sure how that would, I mean, how does that work? How do y'all intend on that working? Because we don't have a lot of other food security funding, and so I wouldn't have the people to do the work.
What does security have to do with food?
I'm so sorry.
What was it?
He said, what does security have to do with food?
What does security have to do with food? I'm unclear about that question.
Yeah. Well, food security has a lot to do with food, so I will answer that. Like, we do definitely want to make sure that people that don't have the opportunity for food are given the food security piece of it is very important. So I think we're going a little bit off. So Stacy, I will stick to your question of how that incorporates. And we do see that funding still getting funneled to you. It just wouldn't be funneled to you through us. And Dylan, please correct me if I'm wrong. The opportunity would make it so that also for these smaller organizations, that hopefully they don't have to take some of the overhead too. So the food portion of it could still be funded to flow to you, versus having to also then have an administrative piece of it that you have to take care of. So that is our thought on it, is that it would help potentially help mitigate some of those that administrative piece, and we could flow some funds through to you or to another partner in a way that is more efficient.
Yeah, hi Stacy too. I think Lori was thinking too, like your funds wouldn't be cut, you'd be getting the exact amount. Well, contingent on legislature and the governor sign off and this committee sign off, but you would be getting the funds that the committee recommended. They would just be going to Three Squares like a partner above you, because I think you work with Three Square right now or get food through them. So they would just be kind of distributing those funds through themselves, but you'd be getting the same exact amount of money.
Okay.
There wouldn't be a reduction in funds.
Okay, I thought it was that y'all were recommending that there was no funds.
Oh, no,
So
no, no.
I didn't know how I was going to do the work.
Sorry,
at that point.
was
Marlena for some reason likes to get paid. You know, I don't know.
Listen, we like to pay everyone.
Yeah. But no, there you get the same amount. Just because you're working with Three Square, it might be a little easier for you to data collect through Three Square, and then they would kind of give us that data as well. So just giving, maybe potentially helping you out with that kind of aspect of it, but you'd be getting the same amount of funding that the committee recommended.
Okay, that makes better sense. Marlena, did you have any follow-ups on this?
I have one question. So I do work with Three Square closely. I understand what they do. In our application, there are partners that we want to work with that Three Square does not currently work with. So we would just be looking at them becoming partners with Three Square for us to continue to serve. Would that be the right way to look at that?
I'm going to allow Amber to answer that one.
Fernando, this is Kelly Quintero for the record. I just want to say that this is really information to present to the Grant Management Advisory Committee, and we can hold questions for public comment at that particular time at the end. So we need to hold these specific questions regarding the funding for public comment. It's only for committee members at this particular time. Also want to note that this is just funding recommendation. And when it comes time for negotiation of awarded funds, that would also be a time to ferret out some of these other more detailed questions.
Okay, thank you for the clarification. So if I understand you correctly, this is the first of 4 funding streams or funding recommendation items we're going to hear today. We appreciate again the presentation. I'll ask for questions from the GMAC committee members, then move forward. But there will be time again at the end for a public comment for anyone wishing to make any. So if that's my understanding is correct. Kelly, thank you again for the clarification. So let me ask the GMAC members one final time. Any questions for our presenters on agenda item 5? Hearing none, I'd like to, I guess maybe a procedural question. Do we be the time to move forward with a vote on the funding streams, or hear all 4 agenda items and then vote each one at the same time right before the final public comment? So Kelly, I don't know if that's a good question for you. Because I can certainly entertain a motion to approve
Fernando,
the funding. Please.
I was going to say with that, just a clarification question. I don't know if it goes to Kelly but does somebody need to recuse themselves from a vote if they potentially are awarded part of that funding, just so there's not an appearance of conflict of interest? It's truly a question. I don't know if we have a diagram here or not, but I'd rather ask now than clean up a problem
Ellen, that's
later.
an excellent question. My understanding is acting chair of the various committees that clearly we rely on the committee members themselves to identify themselves if there's a potential conflict of interest. That's a point well taken.
This is Elisa Berlin. I just had a quick question. Are we going to identify our conflicts of interest prior to the vote, or would you like for us to identify them now?
My view, as long as they're identified, so we're going to identify now, that's great, or right before we take the vote. Sure. Since you have the floor, if you'd like to right now, that works.
Sure. So I have a potential conflict of interest that I'd like to leave up to GMAC. I previously worked for Catholic Charities of Northern Nevada. My last day, I think, was maybe a week or a few days before this, the FHN application was submitted, and I was a part of the original drafts, but I have not seen the final draft, or I was not part of submitting that final draft. And I have no current relations with Catholic Charities or indirect or direct benefit from them receiving award funds.
Okay, I'd ask for any questions from GMAC members on Elisa's statement. I will state first, my understanding is that you had no part of the final document that was submitted.
Correct. I have not seen the final document, but I was a part of writing the original drafts.
Okay, I might want to yield to staff on that. I myself don't see that if you didn't have part of the final, but there must be precedent. So I'll yield to GMAC staff for their opinion on that one. Any other GMAC members with a question? So for any GMAC staff member on the call, I may ask your opinion then. It's been stated that Elisa has had was part of the initial draft, but not part of the final submission. That qualify as conflict of interest from the staff perspective.
Kelly, what do you think?
I just want to get clarification. It was the initial draft of the response or initial draft of the NOFO?
The initial draft of the application materials.
Then I would say, yes, you should refrain because you are part of that submission.
Okay, thank you.
Thank you, Kelly.
Thank you.
Okay, before we move forward, and I'd ask Shannon, with Elisa recusing herself, do we still have a quorum for a vote on this agenda item?
Miss Caliendo joined. She was having some technical difficulties, but she should be present now, and that will keep quorum with if she abstains.
Okay. Okay, well, thank you. That being the case, I would entertain a motion to accept the funding recommendations with or without modifications from any member of the board, keeping in mind we will hear again on public comment that could impact that vote. But for now, is there a recommendation from the floor, if you will, to accept the recommendations as stated?
Hi, this is Ellen. I will put forth to go forward with the recommendation as stated for funding.
Thank you.
This is Tom McCoy. I second that.
Okay, there's been a motion made and seconded to fund the recommendations as stated for agenda item 5. All in favor?
Aye.
Aye.
Any opposed? Motion passes. Okay, let's move on to agenda item 6 regarding the tobacco funding. Pelaman, I think I saw you on the screen just a second ago.
Hello everyone. This is FHN Tobacco NOFO. I will share my screen.
This is Fernando. I'm having trouble hearing you, so other people on the call may as well.
Yes.
Can you hear me well now?
Very low.
Yeah, very low.
How about now? Same. Is it better now?
Oh, yeah.
Oh, yeah. Very good. Thank you.
Perfect. Thank you. So let me share. Right. Hello, everyone. I will talk about the FHN Tobacco funding recommendations to GMAC. But before that, a little bit about myself. I am Talima NOFO. I'm the Population Health and Wellness Manager here at CDPHB. I oversee both the tobacco control program as well as the healthy aging program. The next slide shows about the mission, vision, and purpose of DPBH. These are already mentioned by Dylan, so I will not repeat. Also, Dylan did a great job of talking about the FHN NOFO in general, and also he showed the timeline. So it's the same timeline for both the NOFO. So I'll not repeat those information. I will jump on to the evaluation committee members and the applicants we had for the tobacco funds. So we had 4 members in our evaluation committee. One of them was Alison Calindo. She was from Kinship Care Advocacy and Policy. The second committee member was Alison Gonzalez. She is a program evaluator here at CDPHP. The third one was Amber Heiss. She is present here and is also the section manager for CDPHP. And last but not the least was Tom McCoy, who is also present here, one of the evaluation committee members. We had 4 applicants only, Carson City Health and Human Services, Northern Nevada Public Health, Partnership Douglas County, and Southern Nevada Health District. This slide shows an overall view of the committee member scores for all the applicants. As you can see that it ranged from 141 to 144, which was pretty close. The evaluation committee also had some comments which were basically related to the scope of work, and I will work with my partners to address these comments. But overall, there was a general comment is that the evaluation committee liked all the partners that applied, and they think that all these partners can be funded. However, as we know that there was a cut in the FHN fund, so we unfortunately cannot give them whatever the partners asked for, and we thought that we need to make some reduction from all of them. So this is what the recommendation looked like with the Carson City Health and Human Services around 51,892, Northern Nevada Public Health 162K, Partnership Douglas County 111K, and Southern Nevada Health District, the one that served the largest, Clark County, is getting the highest with 377K. That comes to a total of 703,730. So the recommendation is that these are the funds that we will provide to our partners. And just one thing to mention is that a part of the FHN grant is also paid for our Nevada Quit line, which provide the cessation services, and also a part of the, a very small portion of the fund is also kept for the administrative services that is provided as part of this grant. That's it. That's a pretty short presentation I have here. If you have any questions, I'm happy to answer. Thank you.
Okay, this is Fernando again. Thank you for the presentation. I appreciate that overview. For
Thank you.
GMAC, you betcha, you bet. For GMAC members, any questions regarding the presentation on agenda item 6, Under Healthy Nevada Tobacco?
Yeah, this is Tom. Telemann, I heard you mention the quit line, and I know there's some challenges from federal funding. So where will the quit line be if these dollars stay as recommended?
Yes, that's a really good question, Tom. I'm having this internal meeting at the end of this week to decide on the quit line going forward. But for now, we will keep the funding as it is. But if we see any changes, then we will have to change accordingly.
Thank
I hope
you.
this answers your question. Yeah.
All right, thanks, Tom. Good question. Okay, we have a funding recommendation made by staff. And so I would entertain a motion to approve the funding as recommended, or if there's any modifications, to state those modifications. So with that being said, is there a motion by anyone to make?
Yes, this is Allie Caliendo, and I'd like to make a motion to fund the partners as recommended by staff.
Thank you. Do we have a second?
This is Ellen. I'll second.
Thank you. We have a motion on the floor and a second to approve the funding recommendations on agenda item 6, Funds for Healthy Nevada Tobacco. All in favor?
Aye.
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 Opposed?
Aye.
Motion passes. We're going to move on to agenda item 7. Those of you may have come on for item 4 or may have joined late. I do plan to circle back to agenda item 4 after this next one, but we're going to move forward with the Grief Support Trust account. Michelle McNeely.
Thank you, Fernando, and hello, committee members. Just waiting for that presentation to pop up here, and thanks, Shannon, for sharing that. If it's not working on your
Any
end,
moment now.
okay.
Hmm. Yeah, you may need to take the reins on that. I'm not sure what's happening.
Okay, well, I will just share the PDF version if that's okay. It has the same information. Okay, so I'm Michelle McNeely. I am one of the program grant managers here in the grant management unit at the DHHS Director's Office. And one of the funding streams that I help manage is the Grief Support Trust account funding. And we just reviewed applicants for the NOFO we put out for state fiscal years 26 and 27. And I'd like to go through that information with you all and make our recommendations. First, I'll go over the eligibility criteria and let you know what the available funding is for the next 2 fiscal years. Briefly go over the applicants we received and then our recommendations. I know we kind of went over this before, and I know we have some new members. So the eligibility criteria for this funding is in support of children who've experienced the loss of a relative or other person of significant connection, or parents and adult caregivers who've experienced the loss of a child. Nonprofit organizations must meet the following criteria: minimum of 2 years experience in providing age-appropriate peer support groups for children between the ages of 3 to 18. Provide such peer groups biweekly from September to May of each calendar year. Is a current member of the National Alliance for Children's Grief. Provide these grief support services free of charge, and keep aggregate information relating to various points of data mentioned below. The available funding has decreased, kind of like everything it seems like today that we've discussed. Currently $61,406 has been budgeted for the next 2 fiscal years for each fiscal year. So that's what we're working with. And this funding comes from fees that are generated from death certificates as dictated in NRS 440. And I provided a link in this presentation as well. The applicant review, so we received 2 applications, kind of what we anticipated because of the criteria, especially being a member of the Alliance for Children's Grief. So these 2 organizations are ones that we've worked with for a long time. And so those are the 2 applicants that submitted applications. On the left-hand side there, you'll see our criteria and various parts of the application that were required and the points assigned to each, and then the page limits, etc. And then totaling up to 100 points total. Both applications were reviewed by 3 review committee members and scored using the rubric to the left. Based on our review, the Adams Place application received an average score of 82, and the Solace Tree received an average score of 60. In our NOFO, I wanted to quickly just go over, well, I can just, because I'll have to switch a screen. So an average score of 60 is basically the an average score, and then anything over that, like a score of 80 would be actually, I do want to look at that. So 60 is average, 80% is strong. So I just wanted to confirm that for you guys. Based on prior successful outcomes from both organizations, geographical coverage of the state, and scoring, the GMU recommends that the funding is split as follows. Adams Place receives 75% of available funding, and that totals $46,054.50 for each fiscal year for 26 and 27. And the Solace Tree receives 25% of available funding, which equals $15,351.50 for each fiscal year for 26 and 27. And we respectfully request any questions, feedback, and recommendations from the committee related to this funding to be provided to Director Whitley. Thank you for your time.
Okay, Michelle, thank you. Appreciate your presentation. Appreciate the information. Are there any questions from any GMAC members regarding this particular funding stream?
Yeah, this is Tom. Michelle, in terms of statewide coverage, who handles most of the rural sections of the state? Which one of those?
The Solace Tree handles most of the rural Northern Nevada areas. We do want to expand, but unfortunately with the funding we have, it's kind of restricting. We want to look at more rural coverage, but right now the Solace Tree does cover Washoe and surrounding counties.
Okay, good question, Tom. And any other questions from GMAC members? Hearing none, I would entertain a motion to approve funding as recommended by staff.
This is Tom, so moved.
This is Allie, I'll second.
Okay, thank you both. There's been a motion made and seconded to approve funding as recommended by staff. All in favor?
Aye.
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 Opposed? Motion passes. Okay, I'm going to circle back to agenda item 4 and ask someone from ADSD office to present this funding stream.
Good afternoon. This is Cheyenne Pasquale. I apologize for my tardiness.
Oh, welcome. Welcome.
I'm going to talk about the prescription drug program, and then I also have just a couple of quick slides on some of our other funding source, just as an FYI for the committee.
Great, thank you.
Okay. So for the prescription drug program, we have a total of $313,000. We are looking at reductions in state fiscal year 26 and 27. We expect that this will increase wait lists and also will limit our ability to expand this program statewide. We changed the model for this program in the last biennium based on some legislative changes. And so with that, it was prior to this last biennium, it was a program that was operated within ADSD, and we changed it to a subawarded program. And so we have one existing applicant, and then there were 7 new applicants. The top score for this funding source was 86, and that's Access to Healthcare Network, and that is our existing applicant. So that is who we are recommending for funding for this next go round. just as an FYI for the committee, we also have senior FHN dollars for senior services. It was a non-competitive process for state fiscal year 2026. We are looking at approximately $5.6 million in funding available in state fiscal year 2026, which is a reduction of $962,000. There's a total of 51 subawards, and the bulk of this will be in-home services at $3.4 million and transportation at $2 million. And then we have the $200,000 set aside for assisted living supportive services. And then last but not least, the Nevada 211 program is funded through FHN dollars, and we are looking at reductions of $109,000 in state fiscal year 26 and $107,000 in state fiscal year 27. We are working with the vendor to evaluate options for that service now. Our Nevada 211 call specialists are currently in the lowest tier of pay in the nation. So we are looking at potentially reducing hours of service. Right now, it's a 24-hour service. We're looking at moving potentially away from a 24-hour service, reducing outreach efforts, and then we have 2 phone apps that we support through this contract, and we're evaluating whether we'll be able to maintain those apps or not. And that's really my presentation, but any questions?
Yeah, GMAC members, any questions on this item?
Yeah, this is Tom. I got a question regarding the 24-hour. Have we seen historically that those overnight hours, those hours that may be cut, have generated most of the inquiries, some of the inquiries, none of the inquiries?
There's a fair number of inquiries. I don't have the data on hand, but I could send that out to the committee. There's a fair number of inquiries that happen in the overnight hours, but certainly the bulk of inquiries come like in the early evening hours and in the early morning hours.
Okay.
It is not the majority, I should say.
Right. So there wouldn't be a significant impact, unless, of course, you were calling at 3 in the morning. But I mean, as far as the majority of calls, this would meet that need, it sounds like.
Correct.
Okay, you identified a few funding streams. So can we take all of those, and let me ask the GMAC staff, can we take all those recommendations in one vote?
I believe when I looked at the agenda, the notice of funding opportunity that was linked was for the prescription drug program. I think I went a little outside of the agenda, just giving my FYI. So
I wanted to make sure. Thank you. Okay. Thank you for the clarification.
Yep.
Having that clarification, I'll just entertain a motion to approve the funding recommendation per the funding stream identified on agenda item 4.
Hi, this is Ellen. I will move to pass this agenda item.
Okay, thank you.
Second from Tom.
Second from Tom. All right, been motion made and seconded regarding the funding recommendation on agenda item 4. All in favor?
Aye.
Opposed? Okay, motion passes. Before we move on to public comment, I want to thank the staff on these 4 funding streams. I appreciate your information. It was very, very thorough, gave us a good understanding of the funding process and the applications received. Having said that, agenda item 8, public comment. First, those joining by the teams. Hearing none.
Oh, this is
Go ahead.
Amber. I did have a question about the Funds for Healthy Nevada, there was 2 recommendations from staff, one for the 7 partners and one for the 9 partners. Was there a clarification on what GMAC recommends?
You mean what the GMAC staff recommended?
Yeah, if they preferred one versus the other, I guess is the ask.
Okay, I just opened it up to any GMAC staff.
Because I think how it was worded is that it was worded that the staff recommendations, and I do believe we recommended 2 things. So.
This is Kelly Quintero for the record.
Go ahead, Kelly.
Amber, are you saying that there were 2 choices given to the GMAC versus 1 choice?
Yes. Our recommendation was either 9 partners or 7. And I don't know if that was clear, and I apologize if that wasn't clear.
No, but I would ask that you and your GMAC coworkers would know these providers better than we would. You might be in a better position to recommend to us 9 or 7.
And
this is Kelly Quintero from the record, because it was already voted on and there was yes or no. Fernando, do we have to just bring this back to a vote?
That would be my opinion. I think that would be the safe thing to do, is this with clarification, whether staff recommends the 7, staff recommends the 9, and we can vote accordingly. Then there's no question.
Hi, this is Elisa Berlin. Just in terms of voting, I would love to hear more clarification of generally what the anticipated scope of work would be if organizations were made to collaborate in the way that is suggested. And also my thought process would be, what would the agency burden be? And I think that for me, of course, I would like to see what your recommendations are, and you would know the organizations better than us if you could present that information to us when the time comes to vote.
And I think ultimately we had a very clear, concise delivery of the 9, whereas the 7 was, I think, more optional if they didn't feel like 9 was a reasonable, if 9 wasn't a reasonable staff amount or partner amount. But ultimately, we did give a clear understanding of the 9 and how it would be how each one of the funding sources would be aligned. So I do feel like that is the more clear and concise version, I guess. So I don't know if we want to just stick with that and vote on that.
This is Allie, and personally, if that's a recommendation that you're making, which I'm kind of reading that it is an option, I would prefer to vote on the 9 organizations getting the allocated funding as recommended, as opposed to doing a collaboration that I don't think was in the application, and so they may not be prepared for. So I'd prefer to make a motion on the 9 unless there's other questions or comments.
Well, thank you, and I agree with that. And I liked, Amber, your verbiage. When you said 9, you followed by saying concise delivery. I like that terminology, concise delivery. So I think that it would behoove us then to move forward with funding the recommendation based on 9 providers, and let's see if there's a motion and a second. So I believe Allie.
I'll make a motion to move forward with funding the 9 providers as outlined in the recommendations.
All right, thank you. We have a second.
This is Elisa Berlin. I'll second.
All right, thank you. There's been a motion made and seconded to on this recommendation regarding 9 providers. All in favor?
Aye.
Aye.
All opposed? Okay. Thank you. The motion passes. So thank you. And thank you for that clarification.
Thank you.
Okay.
We appreciate your guys' support.
Actually, I'm so sorry to interrupt. I just realized that I had previously recused myself from the original vote. So if you can redact my second and if someone else could second.
I think you'd have to revote.
That's fine. To be procedurally correct, I'd rather do just that. Thank you, Tom. So we have a motion made by Ally to fund the 9 providers. Is there a second to that?
I'll second it. This is Tom.
Okay, motion made and seconded. All in favor?
Aye.
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 Opposed? Okay, motion passes. Thank you all for that clarification. I think that's sound. I think we're moving forward. We're going to continue with public comment and sure everyone has that opportunity. Okay. Hearing none on Teams. Anyone on the phone wishing to make public comment? Hearing none, I'll just move on to agenda item 9, wrap up and adjournment. I want to thank the staff. Having been involved with these sorts of projects, I closed the meeting the way I started, back since the disco era. A lot of proposals since the BG's 8-track was out there. But the common denominator still is the dedication for youth and families in our state. And so for our staff to take the time to review, for all the applicants and service providers to do what you do, thank you for that as well. And collectively, as a unit, we'll just move forward addressing the needs of youth and families in our state. Having said that, I'll go ahead and adjourn. I believe our next meeting is in May, but I'll let staff get the notifications and that sort of thing out for that meeting as well. So in the meantime, thank you all, and let's keep moving forward on behalf of Nevada.
Thank you so much.
Thank you.
Take care.
We'll see.